Hey everyone, it's Dr. Hillary from Rangeline Chiropractic. I have a wonderful dentist on today. This is Dr. Deldar. He is in Noblesville and he is going to talk to us about sleep apnea. So tell us a little bit about your practice and then tell us some things to know about sleep apnea. I'm sure we're all excited to hear about this.
Sure. Thank you for having me. As Hillary mentioned, Mike Deldar. I'm a general dentist practice at the corner of 146 and Hazel. Dell. I'm treating the J and sleep apnea last 24 years. A lot of people, they don't know about the sleep apnea because unfortunately there's no medication for it, and therefore there's no mandated by pharmacy for the education purpose. Therefore, a lot of people, they suffer from a sleep apnea. They don't know. A lot of people, they think sleep apnea just is snoring, but the snoring is just the body try to tell you something wrong. And the majority of the time, people, they go to bed like around 8, 9, 10 p.m. They wake up 6, 7 a.m. They thinking they have a good sleep. But the quality of that sleep is very important. How long you be in deepest sleep? If you don't get through the deepest sleep, that quality of the sleep affecting in the hours you are during the day you are up. I highly recommend it if you feel tired, exhausted. Uh, Definitely do the sleep studies. These days, you don't need to go to the centers. You can do that one at the home sleep studies. At least they can find out what's going on during your sleep. Is your airway is narrowed down? Is your heart rate? What caused you to wake up in the middle of the night several times to get up to go to the bathroom, or wake up in the morning and still you are tired? Uh, Sleep apnea is dangerous. Again, is not just the noise. It can cause a stroke, heart attack, obesity, and these days more and more people prove it. A lot of people, they think obesity causes sleep apnea, but in reality, sometimes sleep apnea causes obesity because all the hormone change, everything in your body happen. Therefore, your body cannot regulate the hormones to for the sleep apnea, for the weight gain and stuff.
Yeah. That's a great point. Sometimes it's like the chicken or the egg, right?
Yes.
Which one came first, but finding the root cause of something might be the best case scenario, right?
Yes, it's amazing, Hillary. You can see some people, some of our patients, they come really, they are physically so fit, they are not obese or anything, but when they do the sleep studies, they find out they have a very high sleep apnea, very severe sleep apnea, and they need help.
Yeah. Now, I remember us talking about this a while ago. Correct me if I'm wrong, that you offer home sleep studies where people can pick them up. Do you still offer that?
Yes, I'm working with a lot of sleep doctor, neurologists, because we do a lot of oral sleep appliance as alternative to the CPAP. Therefore, I purchased have the equipment to monitor patients' success with the oral appliance, but we use it as a screening tool. Also, we can send the patient home for the screening. Again, I'm as a dentist, I don't diagnose them, but if I see something going on, I can encourage them to see their medical doctor to be checked.
Yeah, I like the idea, and I'm sure a lot of people listening, knowing that there is perhaps an oral device instead of the sleep apnea, the CPAP machine, because I feel like a lot of people and patients that I know, like, oh, I don't want that because it's so horrible, or it used to be so horrible, right? And maybe knowing there is something else out there.
Yeah, I'm sleep medicine. There is usually three options you have is the CPAP, oral appliance, and the surgery. Surgery is very painful, 85% failure, and they not being recommended. CPAP is very good, and still American Sleep Medicine recommended for the people that have a severe apnea. But unfortunately, 75% of the people they give them the CPAP, they cannot tolerate it.
Mm-hmm.
The oral appliance since 2006 become as an alternative treatment option, and the proper oral appliance can be a very good alternative to the CPAP.
Mm-hmm.
But you have to understand sleep apnea is not just the treating it with the CPAP or oral appliance. It's a life change you have to do. There is some biophysical you have to do. The tongue have because the position of your tongue is very important. You have to work on your posture, because if the mother you have be sitting in the car or telephone, all they need your help to get that posture right, because the way they learn function, that posture correction is very important to the good treatment.
Yeah. And I can imagine once patients are correcting the sleep apnea, the amount of energy they have and how much better their body functions. I'm sure that you've seen it. And just like how grateful and thankful they are, probably that you have noticed that and the change their life. I mean, I'm sure you can comment about a patient or two that how great they've done once, you have gotten them a device and they've changed some lifestyle stuff.
Yeah, it's important because a lot of people, they have like the chronic fatigue, tiredness, and some people in the depression, because they never get good sleep.
Mhm.
They always get a light sleep. They never go to the deep sleep. The body, the hormones, regulation, all the brain thing, the hormones happen in the deep sleep. But if they don't go to that, therefore they're under stress. A lot of them, they start at memory loss, depression, chronic fatigue. They don't have a mood to do anything, get up to do exercise, because the body goes to conservative mode.
Yeah, it's such a vicious cycle, isn't it? Knowing that perhaps they need to exercise, but they don't get enough sleep, so they don't wake up in time to maybe do the exercise, and then they're gaining weight, and the hormones are out of control, and perhaps the medical community is recommending a lot of different drugs, but that's not really fixing the problem, so to
Yeah,
speak, right?
that it is absolutely, because medication, all that is masking the problem. They don't get to the root of the like what you do is aligning the body, is your body healing itself. If you do it right, your body is the medicine.
I know we have amazing bodies and they're created to heal themselves, but sometimes they just need the right doctor to help, like
Yeah.
yourself and myself, right?
And then the nutrition, what you put in your body, is a lot of, unfortunately, lack of of the nutrition, because the good stuff is more expensive, but the bad stuff is very cheap. Everybody thinking about is here, but unfortunately, like a vegetable oils, is really not good for your body. And then the effect of it in your body, when you get to your body, taking a long time to get out of your body. And this is the reason you're putting a lot of unnecessary stress to your body. The nutrition is very important, a part of the treatment.
What majority of people do you see that you're recommending to do the test? Like, are you looking at men versus women? Are you looking at an age range? What's the norm, so to speak?
Sleep apnea doesn't have gender, is it happen in both men and women, both of them. I highly recommend anybody above 30 just do the test to find out here, and every 10 years do the test because that test you can these days do it in your own bed, in your own house. It's not invasive or to go to the center like before. Still, some people have a medical doctor recommended to do the sleep center. That's great, but at least for a screening part of it, you can do the home sleep studies.
Yeah, and then it's like at least that's done, and maybe you don't need to do the whole center and sleeping overnight. I think that would deter a lot of people, especially like a lot of my patients that have kids. Like as a mother, I mean, we don't have time to go and leave the kids and do that. Men too, don't get me wrong, but I'm just thinking personally, like it's just a lot of time and money, and just to know, like, hey, maybe just do a home test, see what that says, and then go from there, right?
Hillary, one thing I really noticed a lot, if you just sometimes look at the just conventional sleep studies you do, some patients from the high normal, then they thinking, oh, this patient doesn't have a sleep apnea.
Mm-hmm.
But if you really look at somebody understand the sleep study, look at it, there is something they call upper airway resistant. This upper airway resistant, your airway is narrowed down, but not to the point of being collapsed. Therefore,
Okay.
they don't have obstructive apnea. Therefore, they not stop breathing. Therefore, they doesn't recording in the sleep study. They have a but how much arousal they get, how much the heart rate goes up during the night because of the body getting their stress. and then it has to be like at more than 10 seconds stop breathing. Machine can record it as the sleep apnea. But if they stop breathing in 7 6 seconds, if they narrow down 5 seconds, the body is under stress. And this is something they call it upper airway resistance, and it's a really, really misdiagnosed. And more community, they know before they put the patient the depression medication, chronic pain. It's better you look for that. Is that upper airway resistance maybe the cause of it?
Oh, I did not know about that, so I will start looking into that. So, upper airway resistance. It reminds me of how, like, when you get blood work done and they go, "Oh, your levels are fine because it's not within this value."
Yes.
You're so close to the end that, like, that should be a flag, right? But because it's not within their norm values, they think, "Oh, that person's fine." But we know it's that person's not, or I mean, those values need to be changed.
Yes, because unfortunately, those values been there for a long time and nobody changed them. Because we change a lot of things, but unfortunately, like a sleep study, at the beginning they do there. We go to a sleep center, they connect much water to you. They don't know what exactly it is, but they do it and never change because there is no education about it. Still, we do it the some old way we doing it, versus new home sleep studies or anything. And then beyond all these changes happened the last few years because American sleep medicine approved the oral as alternative. Therefore, there is some money coming to the marketing, education, and stuff, and some changes you notice. Otherwise, before the patient just not compliance with the CPAP, it was enough they write in the chart the patient non-compliance.
Yeah. And then, I mean, it's so hard to use, or at least that's what I hear from patients. So I can see why people are not compliant with it, and like, hey, maybe there's another option. So it's good to let people know their options.
Yeah, and imagine, as we get older, you wake up in the middle of the night, you want to go to the bathroom, you have to unhook yourself, go to the bathroom, you have to wake up to put it correctly back. The oral appliance, the proper one, you just put it in your mouth. You can walk in the bathroom, come back, you just go to bed. You don't need to hear. If you go to the airplane, you need to carry another luggage for your machine. If you sit it in the long flight in the airplane, just put it in your mouth. Don't disturb the other passengers,
Yeah.
I was last week and I have a patient, another passenger airplane is snoring so loud. I just want to get up, give my business.
You shouldn't have put one of those devices in their mouth that they slept. That's like me watching their posture, and I just want to straighten them up when they're sitting there.
Yeah, a lot of people, they snore at the beginning is funny. After a while, you get frustrated, you leave, you go like your spouse, leave, go to the other. After a while, you're really affecting in the relations, stressing because the people they snore, least they know about, is the people around you.
Yeah, you're right. Can affect a lot of relationships, that's for sure. I do hear a lot of people sleeping in separate rooms and stuff like that. So, wonderful. That was a lot of information, and I'm personally going to start to look up more of this upper airway resistance. That way, maybe I could be, a primary screener and send more patients your way for that. And we'll put your information underneath this talk. That way, if someone wants to reach out to you with more information, I know this was kind of an overview today, and then I'm sure that you could do some consults with people over the phone, right?
Sure, definitely. As I said, I'm here to educate people. I do a lot of talking to a lot of medical doctors, other offices. I educate them to know what I do as a neuromuscular physiologic dentist. We treating a lot with the TMJ. One of a lot of medical doctor, a sleep doctor, hesitating to do the oral because a lot of doctors do the arbitrary, just put something in the mouth, bring the jaw forward. It's not that. That one can cause the TMJ problem. And a lot of medical doctors, they don't read the TMJ, therefore they hesitate to put the patient on the oral appliance, and then they have a TMJ come back to them.
Yeah.
That's the reason we're treating the TMJ for more than 24 years. And now if the patient has a sleep apnea, and then because the sleep apnea and obstructive apnea can, and the TMJ overlapping each other 70% of the time.
Wow.
Somebody dying has a TMJ and they have a sleep apnea, always the sleep apnea first because it's dangerous. But if they fill up and helping with blood appliance, then we can treat them with the TMJ.
Great. Great information. Thank you so much for getting on. I know that we had a slight hiccup on the malfunction of the computer story of my life, but I'm so glad that we got to come on and look forward to bringing you on again in the future to talk more about the TMJ issues.
I greatly thank you. Have a good week.